and welcome to the Medicare Empower Hour. This is Erin Ackenheil, and I'm your hostess today. I own Blackpoint Insurance, where we help Medicare beneficiaries learn about the A, B, C's, and D's of Medicare, and we help agents and brokers nationwide learn to launch, grow, and retain their businesses. The Medicare Empower Hour is a very diverse show. It brings on training topics for agents and brokers, education and growth opportunities through the physician community, where we bring on doctors who are growing their practices, learn a little bit about what they do and their philosophy for patient care. We also feature on this show educational topics like learning about Medicare Part D and Medicare 101, ABCs and Ds, and also bring on a carrier spotlights where we learn about different carriers and products that they offer. Well, as today is part of our series, I am so excited to bring on a physician who is growing his practice in the East Bay, in Alameda to be specific. Today we bring on Dr. Elpidio Magalong. He is a very experienced internal medicine doctor who recently moved to private practice and is actually growing his practice and building up his business in the Alameda area. He is a family-oriented physician, believes strongly in developing a strong rapport and relationship with his patients. And I'm so excited to bring him in today to learn a little bit about his strategy for patient care and help bring him to all of you as someone that you can bring to your clients who's taking patients. And for clients out there who are looking for a new doctor, I would really like to introduce you to Dr. Magalong and see how his care can make an impact on your life. So just want to welcome him here. Welcome, Dr. Magalong. Thank you for being on the show. How are you?
I'm well, thank you. Good morning, everyone. Good morning, Erin. Thank you for having me here in the Empower Hour.
Fantastic. Well, we have a bunch of people watching live. So if you know Dr. Magalong, please say hello, talk about his care and how he's impacted your life, and give him a thumbs up and just enjoy the show with us. So, doctor, tell us all about you. What's your philosophy for patient care? Why did you become a physician in the first place?
Yeah, so Erin, I grew up in a family with mostly my mom and my siblings are all in healthcare as nurses, nurse practitioners, and pharmacists. And so I initially I practiced as a hospitalist here in Alameda since 2003, and moved on to, aside from taking care of patients in the acute care setting, move on to take care of them at the post-acute and long-term care. And now here I am. I want to uh, establish a good relationship with my patients as I take care of them, in more focused on preventive medicine and managing their chronic medical conditions.
That's incredible. So, tell us, you mentioned you were a hospitalist. Can you tell everybody what is a hospitalist exactly?
So I am trained in internal medicine. So I basically take care of medical conditions for adults 18 years and older. When I started my practice here in Alameda, a hospitalist is a physician who takes care of patients who are admitted in the hospital. So they're more acute, they have more life-threatening conditions. And so that was my initial practice here in Alameda at Alameda Hospital for about 19 years.
Wow.
And
So
along
lots
with
of
that,
experience. Okay,
yeah, yeah.
gotcha.
So, the practice also took care of patients as they transition from the hospital to post-acute and long-term care, like nursing homes and subacute facilities, as well as I took care and managed patients at psychiatric facilities as well. So that's kind of what I've been doing over the past several years.
Right. So as a hospitalist, would you follow them out of the hospital to the long-term care facility and make sure that they were getting what they needed and there was coordination of their care?
Yes, absolutely. That's one of the things why our practice decided to follow the patients to provide continuity of care and make sure that their needs are well addressed within the community, and take care of our patients really well, and help manage their overall condition, and just bring that good quality of care to the
Right.
patient.
I feel like that's so needed. I can't remember where I read a statistic, but there's a very high readmission rate when people are hospitalized. They end up returning, right? Because their coordination and continuity of care isn't as seamless as it could be. So I feel like the work you do is have done historically is very important to make sure people are not readmitted. Would you say that's kind of one of the goals?
Yes, that's absolutely true. With transitioning from one level of care to another, there's potential things that can happen, and we just want to make sure that the coordination is there, the management is continued as the patients transition from the acute care hospital and back into the community.
Yeah. I can't imagine, honestly, a more perfect fit for someone to transition to primary care, right? Because that's what we're looking for when we think of a good primary care physician is someone who sees us through the course of what we need with specialists and coordinating care and managing our medications and just keeping us as well as possible. I mean, is that what brought you to wanting to work in primary care? What kind of drove that decision?
So as I you know transitioned from following these patients, I realized that I really wanted to focus on the patient and provide that the management, and more so, I wanted to have that long-term relationship, that good partnership with the patient, a strong patient and physician relationship that's focused on the patient as a person himself. So I think I found interest in disease prevention as well as managing chronic medical problems and preventing complications. And really, the importance of nutrition, physical activity, stress management, lifestyle modification to bring overall wellness to the patient. So that's kind of what drove me to become a primary care physician.
Right. Well, you're the what I call the unicorn of primary care, right? So a deeply experienced physician who is growing his practice and taking new patients. So that's pretty incredible combination out there. A lot of people are saying good morning and giving you the thumbs up, wanting to get to know you here. So I like that. A lot of people are going to be, I'm sure, wanting to come to you for primary care. Tell us a little bit about the choice of where you decided to practice. So tell us a little bit about the team of doctors and your philosophy, because when I heard you talking about nutrition and lifestyle, it made me think of where you've chosen to deliver primary care. So can you tell us a little bit about the organization that you're working with?
Yeah, so I joined Marina Village Medicine. It's been established here for several years in Alameda, and our primary focus, really, with our team of there's two physicians in the practice, Dr. Kyra and I, and we have three nurse practitioners that help us. So our focus and philosophy is really preventive medicine and wellness. We do have a weight loss program as well, and just primarily focus on the overall condition and really managing our patients well. We do have a lot of geriatric patients in our practice, being in Alameda, and so for me, it's that hand holding and making it simple as much as possible for the patient to be able for them to understand their medical conditions and educate them so that they can have a better understanding of their options, and just helping them manage through the complexity of their medical condition as things as they you know advance in age, and helping them with these choices.
Right. Well, when I think about it, obviously I'm an agent and broker. We work in the Medicare space. So speaking of geriatric, a lot of our patients are Medicare beneficiaries who have become educated through working with us. And sometimes they're coming from alternative systems of care, right? I think we all know some of the alternative systems for care out there, and they're looking for new doctors. And I think there's a fear factor when people change from like a staff model kind of system moving into private practice, working with large medical groups like Brown and Tolan and practices like yourself, working with you. So how do you go about helping people transition care from maybe a staff model system to working within a private medical group and your physician office? How do you help them through that process?
So, in helping through that, the one of the strengths of our practice is that, the patient is the focus of care. And being said, we try to establish the comprehensive, evidence-based, and compassionate care. So we are very familiar with transitions. We have lots of patients who transfer from, a big more integrated system. But with Brown and Tolan and our network of physicians, there are lots of specialties that we can refer them to. We are more we're independent physicians, and really, that's the niche of our practice is that the personal care that we provide our patients.
Right. I definitely think, and I actually came out and visited your place, and I mean, it's a beautiful facility, and I feel like the whole team is focused on patient care. I mean, there's multiple language spoken in the office. People are working as a team, making sure patients are getting access to care right away, which is a big deal. People get scared. How do I change, and how am I going to manage my medications? Can I get in for an appointment? And I just feel like the ease of how you work with patients makes it a very smooth transition for them. So that's wonderful.
Yeah.
So tell us about the languages spoken in your office. So I know you're multilingual. I think you have a couple different languages spoken in the office. Is that right?
Yeah, so I grew up in the Philippines, so I speak Tagalog, Filipino. I also have a Cebuano dialect because I'm from that province in the Philippines. But our staff, we have staff that are speak Spanish and Punjabi as well.
Wow. So that just helps you be more accessible to more people, which I think is just absolutely a wonderful. So now, what about for you personally? When you think about bringing on a new patient and you think about your goals, what's your approach in terms of your philosophy? I mean, I know that you really are good with helping people through the transition of care, but when you're getting to know a new patient, what's your goal of that conversation, and how do you kind of drive that towards patient care?
Yeah, so I'm a very big advocate of patient safety and quality of care. When I was a hospitalist, I was very involved in this aspect, and in fact, tried to establish good systems and quality of care for the patient. So for me, my philosophy is really establishing that good partnership, mutual respect, and helping them manage their expectations, building that trust with my patients as a person, because there are different situations and family dynamics. Understanding their social and cultural beliefs, respecting those, so because it all ties up to being able to understand and having that shared decision making process, and having that meaningful discussion with the treatment plan and options that they have, moving forward.
Right. That's the thing that I really love about you, Dr. Magalong, is that you treat a person as a whole person. I guess that's your backdrop of, being board certified in internal medicine and seeing the person's whole self, the socioeconomic, the cultural, the health decisions, everything. It's all makes up a person, and you really individualize your care, which I think really makes you stand out from other doctors that are out there. So that is absolutely wonderful. So I know agents and brokers would want to recommend you and your practice to their clients. What's the best approach? Should they, direct them to your website, call you? What's the best way to get in touch with the team?
So the best way would be, to call our practice. The number is at 510-227-5540. They can also visit our website at mvmedicine.com, and our staff would be more than willing to help them answer questions and coverage issues, and help them transition from their care to our practice. So
Right. So we just finished a busy season, Dr. Magalong, called open enrollment, which is the annual election period. It ended December 7th. I was telling you earlier, it's crazy time, right, where people are looking to add or change coverages. But we have another season coming up. It begins in January, and it's called the OEP, which is the open enrollment period. And that's for a period for people who are already on a Medicare Advantage plan, meaning a Part C plan, to make one-time additional change, right? So maybe they're on a staff model system and they've been holding out, or maybe they've had plan benefits that they're not happy with, or a medication that's not working, or access to care issue. It's another opportunity to change. And so if you were talking to those patients out there that are saying, I really need a good primary care physician, and I want to have somebody who can transition my care, are you available to see patients right away or fairly soon if they were to contact you in the first quarter of the year and looking to transition their coverage?
Yes, so I'm readily available for patients. As you said, I'm still trying to establish a practice, and so I don't have a long waiting time. So feel free to call us and let us answer your questions and see if it's really a good fit for you to be in our practice, because that's another important thing that I find is that finding the right physician for you and seeing if you like the practice. So we respect that.
Right. It's a two-way street, right? People are giving me comments. They're saying good morning and oh, OEP is coming soon. So people know that they're going to need to be finding good doctors. People are loving the compassion that you have. And I think it's a really big deal because one of the fear factors that I hear with patients is they're afraid because it could take 3 or 4 months to get an appointment, and they have medication they need to manage, or they have specialists they need to see, or ongoing care. The fact that you're able to see people a lot sooner versus later, and your practice is welcoming to people, is a big deal. And with your experience, you can really help transition people in a really seamless manner. So that's a very big deal. So we work with several Medicare Advantage companies. So companies that are offering Advantage plans, which are kind of all-in-one insurance plans where people can get their medical, prescription, and additional benefits all under one umbrella. And so a lot of people don't really understand how it works, but basically as brokers, we represent all the different insurance companies. The insurance carriers in California work with big medical group partners like Brown and Toland, and then Brown and Toland contracts with physicians like yourself to coordinate all of your care. Can you talk a little bit about the strength of the medical group? You talked a little bit about referring to specialists and having specialists available, but Brown and Toland is a huge group. So I think when people are comparing to like a staff model system, they're wondering, gosh, am I going to have access to all the different specialty care? And you have a really tight partnership with physicians in the community. I think it'd be great to share with some of the potential patients out there how it might work and what their experience might look like.
Yes, so that's very true. Brown and Toland has an extensive network of physicians. We have not had any problems providing specialty care for our patients when they need them. The communication between us and the specialist is there. So, I'm really happy with the practice, and I can honestly say that we will take good care of them, and help them manage and seek that specialty care if they need it.
Right. Well, you are located in the city of Alameda, right? I've been to
Yeah.
your location. So how far and wide do patients go for you? Obviously, if you live in Alameda, call Dr. Magalong and his team right now and get in, but I'm sure you see patients from Oakland as well. Can you talk to us a little bit about your reach and who might be a great fit as a potential patient for your practice?
So yeah, so we are in Alameda. We are by the Webster Tube, so it's really close to the 880 freeway. So we have patients from Oakland, San Leandro, Castro Valley, Berkeley. So we have a good reach of physicians of patients in the East Bay who come and see us.
Right. So if you live in Berkeley, Alameda, Oakland, very, very close to San Leandro, Castro Valley, I know patients out there are looking for a really good internist that can have the experience to see it through. And the fact that you are so experienced with geriatric patients just plays so well with the clients that we see, right, that are looking for a good doctor. So all the agents and brokers out there, you heard it here from Erin at Black Point Insurance. Dr. Magalong and his team are fantastic. And it's not just it's not just the physician, which obviously Dr. Magalong is wonderful, but the office staff as well. So they really work to create a very nice experience for you. We'll get you in with the physician and really take great care of you. So I was just really impressed with your whole office, and I'm excited to recommend you to my clients, and I'm sure other agents and brokers are putting it out there. Individualized care and putting the patient first. They're saying your passion will go a long way. So people are eager to bring new patients to you. So, Dr. Magalong, when you're not building your practice and saving the world as a hospitalist, right? Taking care of the patients at a time. I know you have a family, and so tell me a little bit about your free time. What do you do when you're not busy working, and how are you connected to the community that you live in?
So I'm during my free time, I just love spending time with my family, with my siblings, especially my parents. So that's the where I find enjoyment really in my free time, just hanging out with them. I'm also a sports fan, so I love our local sports team, the Warriors.
Oh, nice, very
Giants.
nice.
So so it's a really nice community to be in, and just enjoying what the Bay Area has to offer.
Right.
Really,
It's pretty wonderful. So, well, I didn't even know you were a sports fan. So go Warriors. They're doing well, right?
we're
So
doing well.
we'll take
Yes.
it. Well, you are just an absolute gem, a diamond in a rough, a unicorn, as I called you before, because to find somebody who has the passion that you do for your patients and the philosophy of spending time, getting to know them, you're just such a rare anomaly. And I'm just so grateful to have met you and that I get to recommend you to patients out there. Would you mind recommending or mentioning one more time exactly how people would get in touch with you if they would like to become a new patient?
So if you're interested in checking out our practice, you can go to our website at mvmedicine.com, or you can call our office at 510-227-5540, and talk to our staff and see how we could provide services and healthcare for you.
Right. And I noticed when I went to mvmedicine.com, there was a patient information form, and there's a spot where people can reference the reason why they're calling. It'd be great if you could type in there that you saw Dr. Magalong on this show, which would be incredible, and be sure to put the reason. And so, Dr. Magalong, it's okay for them to put in there looking to be a new
Absolutely.
patient.
Yes, absolutely. Yes. Thank you.
So as to avoid any confusion about who's looking to grow their practice, it's definitely Dr. Magalong. He's absolutely fantastic. And I'm just so grateful to have you on the show today. One last thing I'd like to ask you before we let you go. If you could leave everybody with one message about their healthcare, one thing that we should all be thinking about in terms of good health, what would be your number one recommendation for us out there in terms of what we could take with us in our day?
I think number one is really self care, taking care of yourself, and prioritizing your health, because that's the most important thing that we can have to enjoy life, really, and find that good fit of primary care physician for you to help you manage your medical problems.
Absolutely. Well, you heard it here from Dr. Magalong. Self-care is key, and he will help you shape that for you and take good care of you. So thank you so much for being on the show. We appreciate everybody being here, the support today, all the good comments. Thank you so much. Take care, everybody. Thank you, Dr. Magalong.
Thank you
Take
so much,
care.
Karen. Bye.